Tana and Daniel on Facebook wanted to know, can I still take my 4-month-old in for vaccines?
Yeah, so we're still recommending that patients bring their children in for vaccines because we want to try to maintain the vaccine schedule and prevent those communicable diseases that are preventable through vaccination. That's still important to us. If you have a wellness visit and there's no vaccines due, we are trying to push them out and move them and schedule them to a later time.
Someone asked about symptoms again of the virus in babies or young children.
So when we talk about respiratory symptoms in kids of any age, if you see any difficulty in breathing, and that can look different depending on your age. So if you have any concerns where your child seems like they're, if they have a cough and runny nose and maybe low-grade fever, but they're active, they're eating well, they're still drinking fluids, you can continue to wash them at home. But if you start to see any respiratory distress, shortness of breath, and that might be hard for parents to identify. So it's okay to call your clinic and say, hey, I'm seeing these symptoms in my kiddo. Should I be concerned? Should I bring them to the ER or not?
Same answer or not for Jennifer, whose 5-year-old has asthma and says, I've heard and read conflicting information that even kids with asthma are faring well, and also asthma being something that makes him high risk for complications. Can you clarify?
Anybody who has any chronic medical condition, asthma being one of them, we could say could be potentially at higher risk. Things are evolving all the time. Things are changing rapidly. So I would say to my patients, what I would tell them is to continue to do what you would normally do at home. So if your child has asthma and they take steroid inhalers or medications that they're supposed to be taking and they're not sick, I would continue to do those normal medical treatments that you would otherwise do. If your child comes down with respiratory symptoms, cough, runny nose, shortness of breath, we would recommend that you call your provider, your pediatrician, or your physician.
One woman actually wrote, this is Gabriella on Twitter, we are on a full lockdown here in Spain and we live in an apartment with no outdoor space. Our 2 toddlers, 3 and 4, are quite active. What can we do to help them get out their energy in a safe and fun way? We've tried yoga, but I feel like they need more.
Mm-hmm. Wow, yeah, I'm sure that's really challenging. So I know there's a lot of gyms and fitness centers that are having some online programs. Kids will do what parents are doing. So if you're doing even some jumping jacks, or you could turn on some music, do some dancing, anything like that, you could get creative. You could maybe make like a little scavenger, depending on your child's age, a scavenger hunt in your house. I think that everyone's getting creative, and there's a lot of great resources out there, and even things like on Pinterest and Instagram where you're seeing people are sharing some of their ideas. So it's been really nice to see how the community can get together.